You probably already know that exercise increases metabolism, but do you know by how much and for how long it lasts after an exercise session? I'm going to walk you through how cardio, high-intensity interval training, and strength training all increase your metabolism and which of these types of exercises has the greatest effect on it. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. If you're anything like me and you like to measure how many calories that you burn during an exercise session on your smartwatch, and sometimes you might get a little disappointed that you thought that you burned more calories than you actually did, I think you're going to have a greater appreciation for the amount of calories that you burn after an exercise session after watching this video. And if you want to learn how accurate your smartwatch actually is at tracking energy expenditure, check out this video up here. Energy expenditure refers to the amount of energy or calories that are burned throughout the day, and exercise is the best way to increase energy expenditure. After an exercise session, our metabolisms are elevated, and we can estimate how much our metabolism is increased by monitoring how much oxygen is taken in and how well our body uses that oxygen. And so the term for this increased metabolism and increased oxygen consumption is excess post-exercise oxygen consumption, or EPOC. Metabolism increases the most immediately after an exercise session, and then it steadily decreases as the body recovers and repairs. Now, how long you exercise and the intensity of the exercise, these are going to be the two main factors that determine the magnitude of the EPOC, meaning how much your metabolism is actually elevated. Now, if you watched my video on how intensity can influence insulin action and diabetes, video's right up here, then you probably have a clue as to how intensity is going to be related to metabolism. There was a recent meta-analysis that compared EPOC across different types of exercises. And the two main ones that I'm going to start off talking about are moderate intensity continuous exercise, also known as cardio, and then sprint interval training. Sprint interval training is when you do an all-out effort, usually on some type of cardio equipment like a bike or a treadmill. You go all out with your intensity or your effort for 20 to 30 seconds, and then you rest for 2 to 4 minutes, and then you repeat. Now, most of the protocols in the meta-analysis, they used either a treadmill or a bike, and with a cardio, the protocols typically lasted anywhere between 30 to 60 minutes. In the first 30 minutes to 2 hours after the exercise session, sprint interval training was consistently showing more calories burned during this time period than cardio. And we're talking about extra calories burned compared to the number of calories that person was burning before they exercise. With the sprint interval training, they were burning an extra 38 to 110 calories. With cardio, they were burning anywhere from an extra 10 to 64 calories. Now, this might not sound like an exciting amount of extra calories to be burned, but wait for it. Don't forget to check out the merchandise link in the description below for your diabetes resistance t-shirt. In the studies that measured EPOC up to 24 hours after the exercise session, sprint interval training took home the gold again with an extra 314 calories burned compared to an extra 60 calories burned with cardio. Still not impressed? Wait for it. When looking at how strength training impacts EPOC, there was a study that tested a 31-minute high-intensity strength training protocol that included bench press, power cleans, and squats. And they did 4 sets of each of these exercises with 2 minutes of rest in between. And they did it at an intensity that was a predetermined 10 repetition maximum. And so what this means is they did about 8 to 12 repetitions for each set, but the effort that they did it at was at such a high effort that they weren't able to do any more reps after their final rep. Their oxygen consumption was elevated up to 39 hours after the exercise session, and the authors estimated that they burned an extra 773 calories during this time frame. Now, this really long time frame and this high number of extra calories that were burned, it was likely due to the body's need to really repair that muscle tissue. Keep in mind that this type of strength training protocol, meaning the 8 to 12 rep range done at an effort that is almost to failure and with short rest periods, like 2-minute rest periods, that is muscle hypertrophy training, meaning muscle building. And if you have diabetes or if you have prediabetes, it is important that you do have some type of muscle hypertrophy training in your exercise program. Diabetes causes muscle wasting, and strength training is the best way to combat that muscle wasting. If you're wanting some help in designing your strength training program, take a look at this video up here. When it comes to burning extra calories after an exercise session, sprint interval training is better than cardio, and strength training seems to be the best. If you want to know when my next video comes out, please remember to ring the notification bell. Thank you for watching.